will do the best of and the first of its kind in the entire country, even in the whole of West Africa. I don't think there is any robot anywhere. The difference between the robot in Lagos and that in Owerri is that Owerri is purpose-built and is meant to serve our people optimally. And more importantly, the expert in charge is from Imo State, not from Lagos State.
Who else thinks Governor Hope Uzodimma is taking healthcare seriously in Imo State lately? Does that mean he's leaving other Nigerian governors behind when it comes to healthcare in Imo State? Imo State has just recorded what could be a major milestone in healthcare delivery. So the Imo Specialist Hospital in Umuguma has performed its first ever robotic-assisted surgery, bringing a level of medical technology that many Nigerians would normally have to travel abroad to access. The procedure was carried out at the hospital's newly established Robotics and Oncology Center, led by Professor Kingsley Ekwueme, a consultant robotic and laparoscopic surgeon based in the United Kingdom. According to Governor Hope Uzodimma himself, the development is part of the administration's broader efforts to transform healthcare in the state and make advanced treatment more accessible to Ndi Imo.
The whole idea is to set up a world-class medical facility using artificial intelligence, robotic surgery, and very advanced medicine in Imo State. You must have heard of Professor Ekwueme resonating in Lagos and saving lives of thousands of people who have died out of lack of good medical for prostate cancer and other associated ailments. So we're lucky as a state that Professor Ekwueme is from Imo State, and he's one of the best in the world. And the charity they say begins at home. He's here, as I agreed. I approached him, and he's also agreed to have a presence in the state. So we'll give him all the support, and we'll enable him to perform.
And here's another interesting part. The center is being operated through a public-private partnership with modern equipment designed to handle complex surgical procedures while also providing oncology services. The state government says the technology can offer greater precision and better visualization during surgery, and in appropriate cases may mean smaller incisions, less blood loss, and faster recovery. But Imo State is not stopping at just having the equipment. The bigger ambition, according to the governor, is to turn the hospital into a medical tourism destination, attracting patients from within Nigeria and even beyond the country. And for residents enrolled in the Imo State Health Insurance Program, the government says healthcare can be accessed for 15,000 naira per person annually. So, from a hospital that has now moved beyond infrastructure and equipment to actually performing robotic-assisted surgery, Imo State is clearly trying to make a statement in the healthcare space. Indeed, they have left other Nigerian states behind. But the big question is, can developments like this actually reduce the number of Nigerians traveling abroad for specialized medical treatment? That is something we'll be watching. What do you think about this development in Imo State?
I'm really and truly delighted to announce that tomorrow will mark a very important day for Imo State. From tomorrow, we shall begin to see in practical terms what becomes possible when government makes deliberate investments in the health and well-being of its people. Tomorrow at Imo Robotics Center, Robotics and Oncology Center, within the Imo Specialist Hospital complex, Umuguma, Owerri, will witness robot-assisted surgery by a team of professionals led by one of our best and brightest, Prof. Ekwueme, leading a team of surgeons from Europe and America. That is a great feat and a significant step for our healthcare systems. Tomorrow's surgery will be the best of and the first of its kind in the entire country. Even in the whole of West Africa, I don't think there is any robot anywhere. The difference between the robot in Lagos and that in Owerri is that Owerri is purpose-built and is meant to serve our people optimally. And more importantly, the expert in charge is from Imo State, not from Lagos State. So when we begin to expand the specialist hospital, our objective was very clear. Looking to build a modern specialist institution with the facilities, equipment, professional capacity to manage complex medical conditions here in Imo State. Much of that vision is being realized now. Across the hospital complex, we now have a modern accident and emergency section with intensive care facilities, neonatal intensive care, dedicated theaters, medical oxygen infrastructure, diagnostic facilities, maternity services, pediatrics, physiotherapy, mental health services, and specialist wards. We have also established this robotics and oncology center as part of the wider plan for the vision we have in Imo State for healthcare. The robotic surgical system is already here. The theater has been prepared. The supporting equipment is in place. And tomorrow, we begin the next stage by putting this investment to clinical use. The first procedure will be led by our dear Professor Kingsley Ekwueme, a consultant robotic and laparoscopic surgeon based in the United Kingdom, though from Imo State. But he will be working with a team of professionals who have traveled all over the world, rendering robotic services or robot-assisted services to humanity. That is exactly the kind of partnership we envisaged. The partnership that works, partnership that will add value to the society. Our plan has never been to acquire sophisticated medical equipment and leave it idle. Equipment must be matched with competence. Technology must be matched with training. Infrastructure must be matched with people who knows how to use it well. That is why we are bringing in experienced specialists who can work with our medical personnel, perform the procedures here, and support the transfer of knowledge and skills to local practitioners. Robotic-assisted surgery gives surgeons additional precision and control in appropriate procedures. In suitable cases, it can support minimally invasive surgery, reduce blood loss, and help patients recover more quickly. But beyond the technology itself, what matters to me is what this means for our people. For many years, patients with complicated medical conditions have to leave Imo State in search of specialist treatment. Some have traveled to Lagos. Others have traveled outside Nigeria. Many families have carried the financial burden, the travel burden, and the emotional burden that come with seeking care far from home. Our responsibility as a government is to change the story where we can. We want more of our people to have access to advanced Medicare here at home. That is also why this center is being developed alongside our oncology services. The oncology facility is designed to strengthen the diagnosis and treatment of cancer. The hospital is also being equipped with diagnostic facilities that include MRI, CT scan, PET scan, mammography, and X-ray services with intervention radiology suite. We are building a system in which diagnosis, treatment, surgery, and follow-up can increasingly take place within the same specialist environment. We have also made provisions for medical oxygen production and distribution within the hospital so that oxygen can be supplied directly across clinical areas without the routine movement of cylinders from one ward to another. Of course, we will install and ensure a reliable power system, which is equally very important, because hospitals cannot function properly when electricity fails at the moment it is most needed. That is why the provision has been made for a hybrid solution. When I mean hybrid, the hospital is powered by solar, Orachi will be handy, and the generators will be there to support them. So 24/7 there will be electricity across the hospital activities. We are also paying attention to affordability. This is a very advanced Medicare. It's very, very expensive. But what you need as a citizen is to just go and pay the 15,000 premium to our health insurance program. And that is all from January to December. So you need the discipline, you need a little premium, and the services will be available to you. Modern medicine has little meaning to ordinary citizen if it remains beyond him or her. Through the Imo Health Insurance Scheme, we are working to ensure that more residents can access quality health care without being overwhelmed by the cost. That principle will remain central to what we are building here. This hospital must serve our people. It must serve the trader in the market, the civil servant, the pensioner, the young family, the child, the expectant mother, and the patient who needs specialist intervention. It must also become a place where our doctors, our nurses, surgeons, technicians, and other health professionals can work with modern equipment, acquire new skills, and practice at a very higher level. For me, that is one of the most important outcomes of the investment. I therefore want to thank Professor Ekwueme and the other professionals who have accepted to work with us as we begin robotic-assisted surgery in Imo State under a public-private partnership. I repeat, under a public-private partnership. I also commend the Chief Medical Director, the management and staff of Imo Specialist Hospital, the engineers, contractors, and everyone who has worked on this project. Tomorrow's procedure will mark the beginning of a new service within this institution. But we should understand that it is only a beginning. The real measure of success will be in the patients treated there, the skills transferred, the specialists developed, the lives improved, and the confidence that our people gradually build in the health care available within their own state. That is the work before us, and that is the standard we must maintain. As a government, we will continue to invest in healthcare infrastructure, in medical technology, specialist manpower, and systems that improve access to care. Our ambition is to become a state where whenever a citizen needs quality medical attention, that citizen has confidence that good care can be found here in Imo State. What we are beginning at this center, we are taking another serious step towards the goal. This center must work. This center will add value to the lives of our people in Imo State. And we are already achieving our vision to the glory of God. Thank you, and may God bless Imo State. Thank you.